Private Health Sector Alliance of Ghana is calling on regulatory bodies in the health sector to step up their oversight responsibilities. This, they say, will ensure an enabling environment for the private sector to function properly in achieving universal health coverage. There's more in the following report.
The private health sector has grown and diversified significantly in Ghana over the years. However, effective collaboration between the Ministry of Health and private sector players has not been optimal. Speaking at its second Private Health Sector Summit, a virologist and the president of Private Health Sector Alliance of Ghana, Dr. Alexander Martin Odum, told JoyNews that as private sector players, they are faced with several challenges.
What the private sector really faces is the processes of getting your regulators to give you your license. It is a laborious process. We need to make it more streamlined. It has to be a process where you know when you start, you're going to go through it this way or that way. But when it's made up of a lot of bottlenecks, then you get frustrated even in the process of becoming a legally mandated facility.
He further explained the consequences these challenges may pose to the health sector if not addressed.
If not addressed, what will happen is that there will be what we refer to as quacks in the system. A quack is somebody who claims a certain profession or claims to be of a certain profession and therefore operate in that profession, when in reality he or she does not have that qualification. And because the person has not been found out, it's just going ahead doing what they please. You find out that a doctor could work like 13 years before the regulators finally find out that he's a quack. Do we know how many deaths have been created? That's going to affect universal health coverage.
Dr. Martin Odum, however, urged the various regulatory bodies in the sector to ensure equity in the discharge of their duties.
So we need to streamline the processes of regulation, and we need to have regulators be up and doing. From facilities that are not meant to be laboratories must not run laboratories. If they are going to run laboratories, then the HEFRA must ensure that the same standard they demand of the laboratory must be demanded of a pharmacy, for example, who wants to do laboratory tests. It is not allowed by the laws. Therefore, we are saying that if they must do it, then it must be done by a laboratory professional. The facility must be accredited as such. But you can't register, for example, if I'm a lab, I can't register to be a lab and be selling paracetamol.
Mausi Numon's report for JoyNews.